Hi, welcome to VNN. It is now established that South Asian Canadians are 8 times more likely to develop type 2 diabetes. We have with us a noted diabetes expert, Dr. Harpreet Bajaj, who is an endocrinologist practicing at LMC in Brampton. Dr. Bajaj is also a research associate at Mount Sinai Hospital and adjunct lecturer at McMaster University. Dr. Bajaj recently attended the Diabetes Canada conference in Calgary and is here today to share his thoughts and comments on what he found most interesting there. Welcome to VNN and Dr. Bajaj.
Thank you, Bala, and a warm greetings to everybody who's watching this.
So for the first time in 3 years, it seems the diabetes experts are gathered in person, isn't it, in Calgary?
Yeah, it is, right? Over the pandemic, all the conferences were happening virtually, so on the computer, and now it was after 3 years that we got together. So it was quite exciting to see everybody face to face.
Was there a big attendance?
Yeah, so there were about 1,000 people in attendance, and maybe about 500 to 600 people still on the computer, so online from the comforts of their home. Yeah,
that's big. Anyway, before we discuss new research, can you please tell us why are South Asian Canadians at an increased risk of developing this disease?
Yeah, so it's probably twofold. One is because of genetics. So our genes put us at risk. Of course, we cannot change our genes. So it's what we call a non-modifiable risk factor. So we cannot modify this risk factor, right? So we cannot change our genes. And so that's one reason. And the second reason we can actually change is our lifestyle. So which includes diet. So what kind of diet do we eat? How many calories? How many carbohydrates? How much junk food? How much snacks do we eat? And also our exercise ability. So as you can see, I'm trying to fight my genes because my genes also put me at risk for diabetes, but I'm walking while we talk, right? So it's important to get as much exercise and eat as less as possible to try and reduce the risk.
It reduces the risk, but it doesn't keep it away, is it?
Yeah, of course. So sometimes genetics is so strong that you cannot keep it away, but many people can delay it at least, not get it at an early age. At least if you get it 10 years later, it's much longer and much healthier life then.
What do you think would be an optimum age to get diabetes? I mean, 50, 60?
Yeah, so there's no optimum age. Hopefully you never get it. But the problem that is happening now especially in the South Asian community, is that kids are getting it, even in their teenage years or 20s, are getting diabetes. And that's a big, scary thing, because if you get diabetes at such a young age, then you have a lot of life that is lost, or health that gets affected, right?
But those who get, say, diabetes at a much later age, after 50s, 55, I mean, for them, it will not be as serious as those youngsters who get it early, isn't it?
Yeah, in a way, because we know that an average lifespan is around 80 something. And so there's less, at least, life left for complications. But then again, it is a serious disease even at any age.
Right. I mean, what is hypoglycemia? I mean, what new information has been presented?
Yeah, so hypoglycemia basically means low sugar, right? So low glucose values. The new information from the guideline update. So Diabetes Canada has guidelines around diabetes. And so an update of the hypoglycemia chapter in the guidelines was presented. The hypoglycemia definitions are slightly different from before. So less than 4 is considered a mild hypoglycemia or level 1 hypoglycemia, and less than 3 millimoles, so on the glucose test, is considered a moderate hypoglycemia. And it's a severe hypoglycemia if somebody gets unconscious. That can be a severe hypoglycemia. Now, of course, we have to realize, Bala, that hypoglycemia in diabetes does not happen on its own. It's only with certain medications like sulfonylurea medications, pills, some pills, and then insulin that causes hypoglycemia. So not without those medicines, there are many other newer medications which don't cause hypoglycemia. But for people on insulin, it is a possible risk that is there. Now, the other new information on hypoglycemia is also about those who can go unconscious with hypoglycemia, very severe hypoglycemia that leads to unconsciousness. Now there is a new medicine that is available which can just be squirted in the nose by a loved one. If you have that medicine at home, of course you call the ambulance, but you squirt it in the nose and it brings the sugar up so that the person becomes conscious again.
I mean, this low sugar is, I think it's more dangerous than high sugar.
Yeah, acutely dangerous. At that point, it can, a person can go into coma or even die if the sugars are very low. They can get into a seizure. They can also get heart arrhythmias if the sugar is very low. So low sugar is very dangerous at that very moment, whereas high sugars over time can be dangerous because they lead to complications of diabetes.
And so low sugar means it's what the count is, what, 4, you said?
Yeah, so mild is less than 4. So between 3 to 4 is considered mild. But if it goes less than 3, then it's considered a more moderate kind of hypoglycemia. So it's more severe than the mild hypoglycemia.
I mean, the normal range would be what, 5, between 5 and 6 or 5 and 7?
So normal is 4 to 7 for a person with diabetes. But without diabetes, if you're talking about a person who does not have diabetes, normal is 4 to 6 is what is normal.
This is what about what is the relationship between, say, mental health and diabetes?
Yeah, so there are a lot of so people with diabetes, because of the chemical changes that happen in the body, are at risk for more depression. That is one relationship. So depression is more common in people with diabetes. It's not a complication of diabetes, but just everything. Your health is not good. Also, you have to take medicines for lifelong. So that all poses a risk for depression. That's one. So it's very important to recognize this and bring it up. Sometimes people with diabetes don't think about it, or their family doctors don't think about it. But it's important to discuss with your family doctor if you're having any mental health issues, if you're feeling sad, if you're feeling any fear. Some people also related to hypoglycemia, Bala, they can have fear of hypoglycemia because once you have hypoglycemia, low sugar, then then people start dreading that they will again have more hypoglycemia, and they then tend to keep their sugars higher, which is in the long term is a bad thing for the body as well. So that's why fear of hypoglycemia is another mental health association with diabetes as well.
What should be done in those cases? I mean, they consume sugar at that time, and what are the symptoms?
Yeah, so low sugar can cause symptoms of shivering, shaking, sweating. So people tremble, they get cold or hot sweats, and they can get racing of the heartbeat as well. So if any of those symptoms happen, they should check their sugar first of all to confirm that it is low. If it is less than 4, they should consume about 15 grams of glucose, which should be sugar, glucose, not like regular food, because regular food takes a long time to get digested. We want immediate sugar. So actually take sugar, or maybe a half a glass of orange juice, or Coca-Cola or Pepsi, some soft drinks, so that the sugar can come up.
I mean, what is it about insulin? I mean, once a weekly insulin, there's a new technique coming up, something instead of a daily dosage.
Yeah, so that's a big convenience plus, right? Right now, the insulins that we have, at a minimum, need to be injected once a day. So that means 365 injections per year. Whereas in research, and we've been participating here in Brampton at my clinic, we have research studies with once weekly insulin, which is a new formulation. There are actually 2 companies that are developing it. And so it'll need to be injected only once a week, meaning only 52 injections per year rather than 365 injections. And that's a big plus, because then people don't need to, poke themselves so many times.
Yeah.
Also, this new insulin appears to have same type of glucose effects. So same type of effects on lowering glucose, and not any higher risk of any side effects also. So it's very safe also in that terms.
Is it a sort of a slow release mechanism involved?
Yeah, exactly. So what it does, Bala, is the insulin goes in the body and binds to albumin, which is a protein in our body. And so it slowly releases that from the albumin. It goes into the blood very slowly. So it releases over a week period.
I was reading a recent report saying that there are more people going blind because of diabetes. Is it a higher risk factor?
Of course. So diabetes complications include eye disease, which includes blindness. What happens is the retina, the back of the eye, can get because of high sugars, can get damaged, where bleeding happens, and people can lose their eyesight, vision altogether. But it's not more than before. In fact, if you compare 20 years ago to now, diabetes complications, including blindness, including heart attacks, are much less now, because we have better medications and better ways to manage diabetes as well. Overall, in North America and in Europe, people are doing better. Now, some communities, again, going back to South Asians, we have a lot of myths, and we don't necessarily trust the system every time, right? Or there may be other barriers, right? So we don't have as much education and counseling regarding our disease as well. Or we hear people say, try this, try that, and we may not always get the right treatment, especially early on in diabetes. So in our community, maybe the blindness and other complications are not as much reduced as maybe for Caucasians, the white people.
What about amputation of the limbs? I mean, is still a high risk for Canadians?
Yeah, so it is much less also
Less now, yeah.
compared to 20 years ago, but we still have some people who lose their limbs or lose their toes. So amputations is needed with infections of the feet or infections of the bone of the feet. But it's much less. The other big risk factor for amputation or losing the limbs is smoking. So cigarette smoking, which thankfully has gone down over the last few decades, but still some people continue to smoke. So smoking and diabetes is a no-no. That's a big risk factor for feet problem.
I mean, is it what? How do people know this? I mean, is it some tingling or loss of sensation in the limbs? Is that it?
Yeah, exactly. So nerve damage. What you're stating, Bala, is exactly how people notice it when they have diabetes for a long time. The nerves get damaged, and in the feet especially, because the brain is the farthest away from the feet in our body, right? And so the nerves get damaged, which lead to tingling or numbness or burning, especially in the night, in the soles of the feet.
Okay. I mean, is there anything new that's happening in diabetes research in terms of future care and caregiving? What do you say?
Yeah, so the new thing at the Diabetes Canada conference, there were 2 new things. One regarding the type 2 diabetes, which we've been talking about, is remission of type 2 diabetes. So remission means, we know in cancer, some people say remission of cancer, right? That the cancer is no longer visible, or you cannot find it at this time. It's not a cure, but it's at least not there at that time. So similarly, at the Diabetes Canada conference last week, in the guidelines, there was a new update on remission of type 2 diabetes by 2 mechanisms. One is a very low calorie, so 800 to 900 calorie meal replacement diet. So for 4 months or 5 months, people give up their regular food and only consume shakes or soups, which have very low calories, for 3 meals in a day. So no regular food. And with that, those people who are early in the diabetes, so within 6 years of diabetes diagnosis, when they are not too long from their diabetes diagnosis, and also those people who are not on insulin. So if they're already on insulin, then this is not recommended for them. And if they don't have heart disease or kidney disease, etc., as well, then those people, maybe about 50% or half of the people may get remission of diabetes, which means they may not need to take medications for their diabetes, and their diabetes may be controlled without medications for some time.
That won't last forever. Huh?
So that's a good question. In the study, this study was done in the UK. At 2 years, about one in 3 people actually still were in remission without needing diabetes medicine. So still good sugar control without needing medication. Even if it's not for everybody and it may not last, even if we can lose some weight with this approach and maintain our health better without taking too many medication, I think it's a positive, and it opens up new options. The other option with remission is for bariatric surgery, which is for people who are very, very obese and they have diabetes.
Their stomach tissue, yeah.
Yeah, exactly. So the stomach is, shrunk small in the operation, and they take out part of the intestine and suture it together again. And that maybe about 2/3 of the people may go into remission without needing to take diabetes medicines as well.
But why is that? I mean, is it because they consume less food? Is that it?
So it's both actually. So yes, they consume less food, but even before they start consuming less food, or even before they start losing weight, what happens in the body the next day or the day after the surgery is the hormones in the body change so that the diabetes actually goes away or gets much better in most people right after the surgery. So it doesn't have to wait until you lose the weight and everything.
Is it true that if you are a diabetic, you will definitely get complications in later life?
Oh, no, not at all. So, now the diabetes medicines and technology and management has advanced so much that most people with diabetes can live as long as people without diabetes and not get complications. But it's very important to talk to your doctor and also, not miss medications that are prescribed, and also try to adhere to the lifestyle, so the diet, as much as you can. Of course, once in a while, everybody has cravings or eat something. But most of the time, if you do all of these things and keep checking your sugars, I think most of the people can actually prevent complications and not get any complications from diabetes. So that's the good news.
When you mentioned smoking as a big risk factor, what about alcohol? Is that a risk factor as well?
So smoking is a risk factor for many things. We talked about diabetes and foot amputations. But alcohol is a risk factor for different things. So liver cancer, and 7 other cancers. So colon cancer, pancreas cancer, other breast cancer. So it's a risk factor for other cancers as well. And also, we know that alcohol can also affect the nerves of the body and the brain as well. So that's another problem with alcohol in people with diabetes. People with diabetes who regularly drink a lot also have more nerve problems in their feet as well.
Right. What would be your advice, for those who have diabetes? What should they do?
Yeah, so the advice is, not so remember that diabetes, even though we call it one disease, it's actually individual. So everybody has their own kind of diabetes, their own set of medications. So make sure you follow your doctor's advice, whatever it is, and keep up with the latest advances of diabetes. We have many such advances. We talked about the once weekly insulin coming up in the future, but also we have better glucose testing, right? So rather than pricking the finger, we have these patch meters, which can tell you your glucose number without poking your finger as well. Of course, these come at an expense, but then again, technology is advancing, and so make use of the technology as much as we can.
Well, thank you, Dr. Bajaj. It was a wonderful conversation about diabetes, and you provided us with a lot of insight. And hopefully, we'll have a conversation later again on the subject.
Yeah, you're welcome, Bala, and all the best to you and all the viewers as well.
Thank you, Dr. Bajaj. Thanks.
Stay healthy.
Bye-bye.